for each of the years. You can see it broken up by salary and wages, contractual services, etc. But overall, not a whole lot of difference between what was approved. The major increases due to that spark money. And unless there are any questions, I can move to FY 2022.
Representative Ballard.
Thank you, Mr. Chairman. I do have a question, and perhaps you're not the person I should be asking. If so, please tell me and I will. Why were those budgets combined and actually under a new heading of State Institutions for Intellectual Disabilities? That is totally brand new. Maybe I've been here long enough to know that that never existed and we never put those two budgets together, even though they have similar kinds of responsibilities and everything. So I guess number one, who made that decision and why?
Certainly with that respect, it was an internal decision to combine those. We wanted to see about combining both the state hospitals for the Parsons and K&I and Osawatomie and Lawrence to kind of condense into one budget analysis. There are several programs that are the same amongst them. So we were trying to see where there were commonalities and wanting to kind of provide them into one VA, trying to provide the information as efficiently as possible. But that was an internal decision.
All right, ma'am. So does that say the secretary made this decision or somebody was recommended to someone else? This is a major change. I mean, when we look at it.
No, that was in terms of the combining the budget analysis, that's our office deciding to combine the two to just provide more the information kind of in one tempting, easily digestible format for you. Just an internal KLRD decision.
It was one of the first questions that I asked, and I thought it was just to confuse me further.
Well, the chairman and I did not talk about this, but when I saw it, that was interesting. I'll voice my opinion because I don't generally keep it to myself. I would simply say this does not seem to be as transparent, and it doesn't seem to be as clearly defined in terms of what K&I does and what Parsons does. I understand maybe some of the logic in it. Does that mean were two people responsible for this budget and now just one has it? Or do they feel they could do a better job by combining the two and confusing the issue?
Honestly, Mr. Chair, Representative Ballard, I would have to defer that to a higher.
Okay, let me take this back. That's why I said maybe you weren't the appropriate person, so I'm not going to go after the messenger here. But if there's someone else we should talk about, then I'm happy to do that as well. But I'm going to take you off the hot seat, and you did a good job in explaining it in as much as you can. So, Mr. Chairman, I turn it over to you.
Representative Lynn.
Thank you, Mr. Chair. Thank you, Mr. Chair. I just have a question where it says that there's a decrease in expenditures for the recruitment of nurses. Is that meaning that the starting salary has been reduced for these nurses, or what is that?
What page would you be referring to?
I'm sorry, page 10. Page 10. Second paragraph. Says that there's included as a decrease in expenditures for the recruitment of nurses.
So my understanding in the agency's recommendation, that was due to kind of contractual staffing to try to, at the time when they submitted their budget, they did not anticipate needing as many contract nurses as at that time. So when they submitted it, they had decreased expenditures in that category. My understanding is that that may have shifted once the COVID pandemic kind of expanded. But at the time they submitted, they were anticipating reliance, less of a reliance on contractual nursing and trying to
Contractual.
recruit.
Okay, thank you. Thank you, Mr. Chair.
Committee, further questions? Okay. Are you through with KNI, Matt?
Well, that would be for FY 2021. I can move on to FY 2022. I would direct you then to page 13 for KNI for 2022. The agency requested $28.8 million, including $13.5 million SGF. This was an increase of 2.4 over what was approved. And a majority of that is the increases associated with their enhancement request. KNI had requested a increase for direct care, raising salaries for direct care workers. If you turn to page 15, you'll see the enhancement detail. It's that first line. They requested $22 million for direct care support salary increases. These are for individuals working directly with residents. My understanding, this would approximately affect about 300 positions. Right now, the base salary is generally about $12.35 an hour, and they seek to raise that to about 14.66 with a kind of a comparable increase for those supervisor positions and things like that. The agency had requested that. The governor did not recommend that enhancement request. So if you'll turn back to page 14, the governor's recommendation is $26.6 million. And that is first the decrease due to the denial of the enhancement request, as well as the reduced resource package, which if you'll turn to page 16, we'll go into the reduced resources for KNI. When the agency submitted their budget, the governor requested it for a 10% reduced resource package. For KNI, their proposal was to, because of the increased FMAP, the federal medical assistance percentage being temporarily increased due to the COVID money. And that is the percentage of how many federal dollars you can get to the state dollars. I know Megan, I think, talked about this a little bit in her caseloads discussion. The agency anticipates in 2021 to receive more federal dollars, which will roll into 2022. So when the governor requested the reduced resource package, they recommended that rather than reduce SGF to utilize FGF, they sought to use that additional funds that they received for the increased FMAP. So when the governor made her recommendation, she accepted the reduced SGF and recommended that they utilize that FMAP savings, what would roll over from 21 into 22, to replace any sort of reduction. So you can see that on the table. Why it's an all funds zero is because they're utilizing increased FMAP savings that kind of roll over from 21 into 22. And so there is an overall not a decrease due to the reduced resources. There's just more of a shift in 2022.
So Matt, on that subject there, just so through the FMAP savings for 2021, by the way you're explaining that, then there was 1.3 million roughly in savings in 2021 from the increased FMAP to roll over into 22's budget.
So, yes, so my understanding is, originally when they anticipated, there wasn't a increased FMAP. So now that there is, they anticipate getting a further federal funds because it's, I think, 6.2% increased. They're going to utilize, my understanding is they're utilizing what they had originally budgeted for, and that extra Medicaid money is going to roll over into 22, where then they propose to use that to offset any sort of SGF reduction.
Okay, very good. Representative Lynn has a question.
Thank you, Mr. Chair. About the FMAP savings, how long will that last? How much time will the federal government give us before they end that?
I'd have to double check with Megan. I know that it is I think it's 3 months after the COVID-19 pandemic emergency declaration has ended. I would have to double check what that actual date would be. But it is supposed to last until 3 months after the declaration is declared ended. But I'd have to double check with Megan.
I think, Megan, we're going to the end of the year on this, are we not? We're planning on at least through 2021, which is June 30th.
Right, that's correct. Right now they are, Department of Health and Human Services has suggested that they anticipate that the increased FMAP will last through calendar year 2021.
Very good. Committee, further questions? Continue on, Matt. I know we're interrupting you a lot, but this is a lot of information to absorb at one time.
Certainly. Well, with that, I would jump to a discussion on the agency's fee funds. If you'll turn to page 18 at the bottom, is just a brief kind of description and table of the agency's fee fund, showing what the balance is, what revenues go into the fund, and what the ending balance is anticipated to be. Keep in mind, my understanding is these are generally funds that are insurance payments that they might receive from individuals with private insurance. Sometimes I think there might be some Medicare funding, but they're not. It's labeled a fee fund, but don't think of it as you may have heard of other fee funds where there's a fee that the agency charges. That's not the case here. These are small payments that the agency receives sporadically due to, like I said, maybe private insurance payments that they might kind of recoup on individuals, but it's not a solid funding source by any means. But the balances are there for your review.
And Title 19 money is?
The Title 19 money is not a fee fund. I don't have a separate table for that. I can let you know that for K&I do have them receiving about $13.5 million in Title 19 funds for FY 2021 and about 14.7 in FY 2022.
But that's just a fancy way of saying Medicaid and Medicare?
Correct.
Okay. Any further questions? Okay.
And
Are you ready? Are you done with K&I?
And with that, if you'd like, I can move on to Parsons.
Okay.
So with Parsons, we can kind of begin on page 10 with regards, about halfway through the page is the Parsons State Hospital and Training Center. So the agency requested 31.7 million, including 15.2 SGF. The increase is attributable to their supplemental. So in FY 2021, Parsons requested a very similar, almost exactly the same request to raise direct support workers' salaries. You can see that on page 11. That amount would be little over 730,000. My understanding is it would affect about 320 employees, and it's very the same for as it was with KNI, where these are individuals working with one-on-one with individuals at the state hospital. The starting salary is about $12.35 an hour. They're seeking to raise it to about $14.66, with comparable increases for more senior positions. The only difference with that is that Parsons asked it for both 2021 and 2022, where KNI only requested it for 2022. So that increase over what was approved is strictly for that supplemental request. And then the governor's recommendation is 58.5 million, including 25.4 million SGF, and that in that recommendation is mostly increased because of, again, COVID-19 related funds that they received for hazard pay, providing funds for PPEs and sanitation. And then in that, the governor did not recommend that increase for salaries.
Matt, you've got them together again with the 58 million.
Oh, I apologize. Sorry. It was 31.4 million for Parsons, and that's on page 11 at the very beginning. That's the governor's recommendation, 14.3 SGF. And again, that is a decrease because of the denial of the supplemental detail, but also there's a kind of an increase to offset that because of COVID-19 funds that they received.
Very good. Continue on.
I would move on to FY22, which if you turn to page 14, you'll see at the very top, Parsons request at the 32.9 million, including 16.7 SGF. Again, due primarily because of the enhancement request to continue what would have been those funds into FY 2020, or those salary increases into FY 2022. The governor's recommendation was at the bottom, 30.8 million, including 13.1 million. And that decrease is due because of the denial for the enhancement request. And then I will note on page 16 with the reduced resources, the very same thing as with KNI. They requested to use the FMAP savings to offset any SGF decrease. So there is a decrease for SGF of about $1.5 million. And it comes to a kind of a zero effect because of their using FMAP savings to offset that. It's the very same thing as with KNI.
Matt, there will still be a decrease in their budget, even with the backfilling with the FMAP money?
Yes, because the the governor's recommendation is based off of the agency's request. So while I think there's a general view to kind of keep the same level of spending, the increase was because of their supplemental request, which, because that was denied, the governor's recommendation is lower than what the agency requested. So the only real change between the two is that the enhancement was denied, and then there is this reduced resources, but because of they're backfilling it with FMAP savings, the reduced resources doesn't really have that much of an effect in 2022 on their budget. Any decrease is more attributable to that enhancement request being denied.
All right, thank you.
And unless there are any other questions, I would just note on page 19 is the Parsons State Hospital fee fund analysis table, very similar to how KNI's fee fund operates. And I will just note that there are zero ending balances because they're anticipating expending what they receive. So. And unless there are any questions.
That concludes your report then?
Unless there are any questions.
All right, committee questions? We're thinking. Matt, will you go over that CARES money and the Sparks money for the committee?
Certainly. So one thing, it is within FY 2021. The agency received some supplemental, some CARES funding that appears in the governor's recommendation, not in the agency's request, just strictly because that money was awarded after the agency submitted their budget. So for FY 2021, there is for KNI, it's about $56,000 that they received in coronavirus relief funds. And then Parsons, it's about $540,000. Those funds are for hazard pay for frontline workers and acquiring PPEs and sanitation means to help protect and kind of keep down the spread of the virus. And the best place really to kind of see that, if you were to look on the summary of operating budget table on page 8, you'll see the other funds there at the very bottom, finance right before you hit the total. And then in the governor's recommendation for 2021, that a majority of that is going to be COVID related funds.
What line was that again?
That's the all other funds there at the very bottom, and the 2021 recommendation. It's about that first column in the governor's recommendation, that last item right before you hit the total. It's $1.6 million. A majority of that is for the coronavirus money. There's a little bit for a foster grandparents fund with KNI, but a majority of that is the coronavirus, and it amounts to about $1.1 million, $1.2 million. And like I said, all those are directed towards more hazard pay, acquiring PPEs and sanitation means to help kind of protect from the spread of the virus.
Representative Ballard has a clarification question.
Thank you, Mr. Chairman. Just another one. You said for KNI, 56,000?
Sorry, 50s. I apologize. It's 560.
Okay.
I apologize. I misspoke on that. Yeah, it's about $560,000. They were received about the same.
Gotcha. Okay. I thought that's what it was, and I thought I better just see, just to make sure. Cool. No, we're good. Thank you.
Any further questions? Okay, very good. Well, Matt, you're off the hook. Good job. Now we'll start. We have Brett with KNI.
Thank you,
there?
Matt.
Mr. Chairman, it's Scott Bruner with KDADS. If I could make a couple of introductory comments, and then if we've got some slides to show you that I was going to operate for the superintendent so they could focus on their presentations. If I could share those on the screen for all of you.
Very good.
Just a couple of comments that I wanted to make. Again, thank you, Mr. Chairman and members of the committee. My name is Scott Bruner. I'm the Deputy Secretary of KDADS for Hospitals and Facilities, and I get to work with the staff at both of the hospitals you're talking about today. They are, I want to thank Matt for his presentation and the work he's done. He's learned a lot since he's taken over our budgets, and he's been very good to work with. I appreciate Representative Ballard catching the Spark money, because I would want to call that out. It's a good chunk of funds that KNI used to help support staff, and we're proud of that. I also wanted to make a couple of comments about Title 19 funding when we get to that point, but I do appreciate Matt's diligence, and it's been a hard time to pick up these budgets when you can't really go on the campuses and do the things that I know he would like to do, but we've enjoyed getting to work with them. The two superintendents for Parsons and KNI are going to present and talk through things, and I still can't see, I don't have the ability to share yet, so I don't know if Javier needs to provide that or if you've got the paper slides in front of you, we can walk you through the slides as we advance.
You don't have the ability to share your slideshow?
It's the button that says share content is still grayed out for me.
Xavier, do you have any? Xavier just sent you a message. Maybe we can figure it out.
It's still grayed out for me. Did you have the, oh, there it goes. Okay. Thank you for your patience. Okay, bringing it up here shortly. So most of what I was going to comment on, Mr. Chairman, was largely what I visited with you about last week when you had me give an overview of the state hospitals in terms of content. The two hospitals for intellectual and developmental disabilities serve Kansans that have profound intellectual disabilities in a home-like environment as much as possible, and to provide them as good quality of life with all the services that they need. And the file's still loading, so you're burning a little bit of time. Oh, there it is. The facilities, both facilities are surveyed by the Department of Health and Environment for compliance with federal regulations. They are classified as intermediate care facilities under federal rules. And so those are the standards that are applied. We provided at a high level the census, average fiscal year to date census and the budgeted beds and positions for your reference. I shared these numbers last week of our turnover and vacancy rates in terms of the staffing. These are our hospitals. The work is difficult and challenging, and so there is a high turnover rate of folks in many of those direct care positions, and so the vacancy rate tends to run fairly high to keep positions filled. I did want to make a couple of comments about state hospital funding.
Scott, just a minute. Hang on just a second here. You're
Sure.
on our computers, but you're not on our big screen. Your presentation. So let's see if we can't. Probably something I'm doing.
If it helps, it came up as sharing a file instead of sharing my screen, if that is helpful.
I was just waiting for you to come back.
Deputy Brunner, what are you sharing to?
I just clicked on the share content at the bottom of the screen, and I opened up a file. It said to share a file.
So I might have to remove you from the meeting. Just re-click the link to rejoin.
Okay.
I think you may have to offer more than $5.
Is that better to see it, Mr. Chairman? I can't tell.
We cannot see it right now.
Not yet.
How's, oop, I don't want the whiteboard. Share.
Here it comes.
There it is.
Okay, and you can see the slides. Oh, there, I see it. Okay. I apologize. Let me get back so I can
Can you make
see.
them larger?
How's that? Is that better, Mr. Chairman?
Yes.
Okay. So I'm still Scott Bruner, and I'm back. Sorry for the inconvenience. I did want to share just one thought about funding, since you raised a question in Matt's presentation. For the state hospitals, the primary funding sources are from the state general fund, Medicaid payments through the disproportionate share program, and then private insurance and regular Medicaid payments. That fee fund that you see that's called the Title 19 fund is how we share those funds across the state hospitals when they come in from Medicaid or disproportionate share. And so that's where that fee fund is how we account for those funds as they both come in as a receipt and then as they need to be distributed among the hospitals for use. So I'm happy to talk more about that if you have other questions. Matt already shared with you the budget amounts for both hospitals. And again, we'll be here to answer questions for you, but at this point, without any more delay, I'll turn the presentation over to Superintendent Wydick for K&I.
Thank you, Mr. Chair, members of the committee. Can you hear me?
We can.
Okay, very good. I hope the slides are worth the hassle that we put into it. I think that they will, I'll go through them and try not to just read them to you, but also provide you some additional information. The first thing I wanted to talk about is our mission. If we could go to the 10th slide. This is our mission, and this is why we exist. And it's been a very, very difficult year, as you can imagine, because a lot of the things on here we were not able to do. We're wanting to support each person who lives here to have a meaningful life. And the way we break that down is establishing or ensuring well-being, which was our main focus through this entire pandemic. We've tried to provide as much choice as we could, but that was difficult under the limited circumstances that we found ourselves in. And then, of course, when it comes to personal relationships and involvement in the community, unfortunately, this last year was exceedingly difficult because just as the people in the greater community, our folks also living here at K&I were not able to experience a lot of that stuff. So we had to find the balance in how to support them and support our mission while also protecting them. The next slide gives you some idea of the folks, how long they've lived here. And this is important because K&I is a home to the people that live here. It's not just a placement or an institution. It's actually a home. And people that have been here, some of them 27%, 50 years or more, which means we've got to know them, they've got to know us, and this is their home. This is important also, the stability of staff, because it adds to quality of services. And when you have someone who's lived here as long as they have, it's important to also then meet them by having staff that have been here equally as long to support them so that we can develop that trust, their specific needs, and be able to support them the most effectively. The next slide provides some of the healthcare needs that we have of the people that we support. And this is also important because it shows the level of needs that are necessary, and the folks that we have are many of them cannot be supported in the community, and that's why they're here. And these are the kind of supports that we have to have in place. What's not mentioned on here, along with the people that can walk or talk, what's not on this slide is also the number of people that are on psychotropic medications, which is 29%. And then we have 48% of the people living here that are receiving some sort of behavior supports because of their needs. And that's important because it shows that what we have is kind of extreme support needs. We have people with a lot of medical needs, as well as people with behavioral support needs. And this is why we had requested the additional funding for our direct support, because it requires a wide range of expertise in order to support the wide range of needs for the people living here at KNI. And what we found is that we've been experiencing, as you saw in the earlier slides, a great deal of turnover and a vacancy rate going up. And that makes it difficult if we're not able to attract good quality staff to stay here for a long period of time, get to know our folks, like I mentioned, with the people living here a long time, and then to have that wide range of expertise. So it's extremely important to be able to attract really good candidates to work here and to be able to keep them here and not have so much turnover. Our request for the enhancement was they're currently making $12.35 an hour when they come on board. We had asked for an increase. Just to put it in perspective, in the Topeka area right now, Stormont-Vail is starting out at a minimum wage of $15 an hour. Target's starting people out at $15 an hour, and the KU health system is starting them out at $14 for patient care assistants and nursing associates. So you can see that we're up against folks that are paying a whole lot more in the community, and yet we're trying to find really good quality candidates, and we try to keep them. So that's why the enhancement was in there. The next slide goes into a bit of COVID. This gives you an idea of how we've done over this last year, and I'm would like to have seen zeros throughout, but of course it's a pandemic, and that's not possible. But I am very proud of the numbers that we have. If you'll notice the number of staff that have tested positive over the past year, we hit 90 and we've been staying with that. We are currently right now with 0 residents and 0 staff that are positive for COVID, and we have been there since last week. So we've gone, we're at a full week now where we've had 0 across the board, and we're extremely proud of that. I also feel that I may have jinxed us, because that's how this year has been. Whenever you think things are going okay, then things don't. But we're very proud of the fact that only 90 people, staff have gotten it, and that they're all recovered. The next piece underneath that is talking about the people living here, and I'm very proud of this number. 17 people that live here had tested positive. The majority of those people tested positive early in the pandemic, as we were all scrambling to figure out what to do and how to get our PPE and what we needed to put into place. And so what we had done is in October, we recognized that as the community's rates of COVID went up, the staff's rates went up, and the residents tended to trail right in there. And there was a pattern that we were seeing through this pandemic. So in October, when Shawnee County exploded and things got really out of control, we knew the pattern was going to occur, and we had to stop it because our folks are very vulnerable. So we issued N95s and had all of our staff wearing them, and we at all times. And what we found was that when the staff's rates of COVID positives went up, the people living here didn't. It plateaued, and we hadn't had any through that through the holiday season, anybody that lives here that was positive. So we are very proud of that. And the way we did this also was we had triage set up so that if there was a positive, we could lock down, and we had processes that we'd go through. We call it triage red. And if things were going better in the community, then we could back down to a triage yellow. So we just had a system in place so that at any given time, whatever the circumstance, we knew what we needed to do. We could communicate it easily by saying we're going to go to yellow, which meant the staff could immediately know exactly what they needed to do. Or if we said we're going to red, they knew what the next step was. And I believe that contributed a great deal to the numbers that we show there. The next slide provides you with some additional information. Just to show you how hard we worked over this last year to protect our most vulnerable people during the most difficult of times. What we had put together is like 89 medical protocols and procedures that were developed that were just specific to COVID, which just shows how much we researched CDC, KDHE, CMS. We've looked at everything we could do, and we tried to follow the processes and protocols the best we could. And we used what we thought was, when they were in conflict, we used what we thought was best, but we put a lot of thought into how we proceeded. It also kind of reiterates this slide a little bit again about how many people were tested positive, so I don't need to go through that again. The vaccination we did, we were one of the lucky ones that got in quick. Our first vaccination clinic occurred on January 4th and 5th. And we had a second one then the end of the month in January. We have a third one that's coming up now, February 15th and 16th. So what that allowed is people to get their first dose, the first clinic, get their second dose the second, and then we also were able to give people that had said no on the first go around the opportunity to get their first dose at the second clinic. This third clinic now, we're right now working with our pharmacy to see if we could possibly get a fourth clinic so that we can maybe once again encourage staff to come in and get their first dose in February, and maybe we can get them all vaccinated. But at this point right now, we have 95% of the residents living here that have been vaccinated, which is a tremendous number, and I'm very happy with that. And we have 39% of the staff that have been vaccinated. Reading some articles, I see that's really not that uncommon to have 39% of staff right now, as there's a lot of people not sure if they want to be vaccinated or not. So we're going to continue to try to encourage that as long as we have clinics that we can provide to them. Also pointed out that we had to support people living here with compassion and patience, knowing that they didn't understand the restrictions. This is really important. Not only were we doing the protocols and putting things into place, but we also had to work with people that did not understand why we were taking away their freedoms. And that created a lot of heartache for them and for us as well, because we knew what we were doing, but we had to do it for them. We have seen an increase in aggression. There's one individual that had 17 episodes of aggression in 2019. In 2020, he went to 30. Very clearly agitated and very unhappy. And we had to balance that. We didn't want to start people on psychotropics and try to control their frustration. We had to understand their frustration and support them through it. We also saw an increasement in elopements and attempts to elope. We had one person who 9 times had tried to leave the building and go somewhere in 2019. In 2020, what they did is 34 times they tried to leave. And that was, I mean, clearly they're just communicating. They wanted out. As a matter of fact, some of my staff wanted to elope, and so did I from time to time. We also saw an increase of aggression and property destruction with another person going from 53 in 2019 to 82. And then we had other people that we had to support because they were finding themselves more and more isolated in their room and didn't want to come out. There was no reason to come out. And I even have one person that spent a lot of time at the window sobbing, which was very difficult. So I wanted to make sure that piece was added in there, that we can talk about numbers, but sometimes the human component can be lost, and that is to how to be compassionate and supportive when people don't know why we're taking away those freedoms. The last bullet on here is I wanted to put in there, we were tracking how many times we contacted Shawnee County Health Department because we just wanted to make sure that we were being as transparent as possible. And so we had the number, and I thought that was important to show that because I wanted to demonstrate that all of our decisions, everything we did was definitely working in collaboration with Shawnee County Health Department so that we could provide them with information to help them with their contact tracing, and they could provide us with information, and then we could work together on protocols. The next slide is trying to demonstrate that we did try to do some things over the last year other than just protect the people living here from the virus. And so what we did is we come up with ideas that would be useful things we could do. We did a K&I beautification project, and this was an opportunity to be outside, get the people living here involved in something outside, and of course you're outside. So during the pandemic, that was a really good positive all the way around. So we created a contest across campus. There was lots of people that participated in the porches in the homes. Every home participated, and then other groups participated by picking like the entrance at K&I or another location to try to beautify it. And it was really quite the morale boost at a time when we were really hurt and struggling. So that was something we were very proud of. We also created a KNI Helping KNI, which was an opportunity for us to show each other we're family members and we support one another. And we collected donations of things because there were people that were struggling with the effects in their own home. And so we just wanted to have something available that if a KNI employee needed something, we might be able to help them through this difficult time. And then, of course, I put in the Harvesters Food Distribution. We are the largest site in this area. The cars wrap all the way around KNI, and we usually distribute around 26,000 pounds of food. So that was important that we continued something like that, especially when the economy was struggling and everybody in the community was struggling. So we felt like we were still able to give back to our community by continuing that. The next slide is what we want to do as we move forward. What we've done is we talked a little bit about the turnover with staff in the direct support ranks and how we needed to have people when we needed them to stay. So what we did is one of the things that we found is when we talked to our staff, they said, well, not only do we not get paid a lot, but we also don't have anywhere to move up to. There's not a lot of growth opportunities here at KNI. At the same time, what we found is with the turnover that was occurring in the homes, we didn't always have the best trained staff because there wasn't enough veterans to show them how to do what they needed to do on an individual basis in that home. So we've started converting 40 of the positions over into a developmental disability specialist position. What this does is it allows a small bump in pay for people that apply and then move into the DDS position. So that gives them some growth and a feeling as though there's another stepping stone at KNI. But at the same time, what it does is it provides us with someone who can provide some supervision in the evenings or on each shift, and they also can be the direct link between the instructors at KNI in the home. I can teach someone how to make a mechanical diet, but when I'm sitting there and I say this is what this individual needs and this is exactly how you provide that, that's much more individualized and specialized. So we felt that this supported us in two different ways. It improved our supervision in the homes on two different shifts. It provided better instruction to our staff that sometimes have not been there that long because of the turnover, and then maybe it'll even slow down some of the turnover that we've experienced. So we will be monitoring how that progresses, but I think that that's going to be positive in a lot of different ways. The next bullet talks about our utilization of direct support staff as CMAs. We've been doing that for over 20 years. Last year, I told you that we were going to try to start moving away from that because of the increased medical needs of our people living here. And so, but the problem we had was we could not attract nursing staff to work here full time. We went an entire year without one applicant as an LPN, and we found that we had sporadic RNs applying, and some of them were not the best quality. So we were struggling with what do we do? We were finding ourselves increasingly dependent on agency nursing, which was an outrageous amount to pay. So what we found was that nurses were interested in working at KNI as a part-time basis, but not full-time. They wanted to work a few days a week on a steady basis, but they didn't want to be full-time. So what we found is if we reached out and started some PRN positions or temp positions, they would not be getting any fringe or benefits. So we could bump the salary up just a bit to attract them, but still not have to pay more than what we'd be paying for a direct support or for a nurse full-time. So we were able to pay them more in their pocket, less to fringe and benefits by going part-time. We currently have 7 PRN, LPNs, or RNs that are covered enough that we've been able to now have 2 of our buildings go to where the nurses are passing meds instead of our certified medication aides. And that would have been unheard of a year ago when we couldn't get an applicant. Now we're getting plenty of applicants. These PRNs are working on a regular basis, so they're getting to know our folks living here. They're starting to know our policies, and they're becoming part of the family, even though they may only be here 2 days out of the week. I want to also point out that our agency nurses for RNs, we were paying between $60 to $69 an hour for them. With our PRN RNs, we are now able to entice them to come out here without fringe and benefits for $32 an hour. So we've seen we've been able to save quite a bit when we have the PRNs versus the agency nursing. Also wanted to point out that in August through October of last year, we used agency nurses 1,130 times, or I'm sorry, 1,130 hours. In the last 3 months, November through January, we used them 974 hours. So we're already beginning to see a reduction in the how much we have to lean on our agency nurses. Think about that. If we were paying $69 for an RN for those additional 156 hours, in that 3 months, that was over $10,000. So we're already seeing a savings by going about it the route that we've gone. The next slide is talking about how we're still continuing to support our community. We still believe and we still see ourselves as part of the community, even though our outreach was certainly slowed way down because of the pandemic. But these are things that we are going to be starting up again as soon as we get a healthy community where we can start to go out into it. And we continue to do these. The seating clinic, we've already started to bring some folks in. And then dental clinic, we've tried to do that whenever we had low rates of positive cases in the community. And then the next slide is partnering with our community. I wanted to once again demonstrate that we are not working in isolation, that we continue to try to, we work with lots of different groups for interns, and then other ways that we work with them. Our foster grandparent program, which is the last thing mentioned on there, we are expanding into a lot of schools now. We've got a new director who's on fire and has been strategizing and has been actually getting school districts to accept foster grandparents when we can get them into the school. So I think that's awesome that she's been able to fill positions, even though they're saying not yet. We can't do it because of the pandemic, but as soon as we can bring them in, we want them in. So we're hoping to see this foster grandparent program grow even more into the schools in the next year. And the last slide that I have is I think that Mr. Moore has already explained most of this. This was our reduction package and how we were going about it. So I won't go through that again. And with that, I stand for questions.
Thank you for the presentation. Committee questions. Representative Lynn.
Thank you, Mr. Chair. It's not really a question. All I was going to say was that I toured this hospital, or KNI, in 2019, and I was so incredibly impressed with it. What they're able to do, how they're able to stretch their dollars to be so innovative, creative, efficient. I think they really go above and beyond for the people there at KNI, and I just wanted to say that. Thank you, Mr. Chair.
Very good. Committee, further questions? Anybody online? Seeing no hands up. Brett, thank you for what you do. I just have a couple of quick questions on the coronavirus relief funds. You had hazard pay. How did that work out? Did that help your staff?
Oh, yes.
Yes. Kind of give us an overview of that, will you?
Yes, the secretary approved merit pay for the staff. They did it on 3 different rounds for, I think it was like 3 pay periods each round. And what the discussion was, rather than go percentage for each person, which would have been unfair because some of us who's not working in the trenches would have gotten more, she did a straight amount across the board for everybody. Each and every person got the same amount for each hour that they actually worked at on campus. That was the biggest morale. That helped us get through. There were times we were really struggling. And so when she came through and did that, that was a tremendous boost for our employees. They were thrilled to death, and they couldn't believe that they got 3 rounds. They were just really, really appreciative.
Very good. And then to further on that line, you folks did receive the 2.5% pay increase last year, the statewide increase. Is that correct?
I believe so.
And what did
I
that
believe
bring
so.
your what did that bring your base rate up to?
I don't have that in front of me.
Maybe
Could I,
Scott can get that. Maybe Scott can
that
get
or
that
I
for
also
you.
have my director of budget on the, she's on the call. So we could ask her for clarification.
I didn't think the governor approved that last year. Am I mistaken? I'm sorry, this is Kelly Lundry, Director of Finance at KNI, but for some reason, I didn't think that got approved last year. Am I missing something? Because I thought our salaries didn't get, or didn't get approved. Scott, can you answer
Yeah,
that?
yeah, we can verify that, Mr. Chairman, and make sure. I think the pay rates that we talked about related to the enhancement request are reflective of whatever if there was an increase applied, but I can verify that and let the committee know tomorrow when we present on the other two hospitals.
That would be a good thing to find out. Representative Homer.
I don't know if I can ask this or if I can ask it nicely, but I'm going to ask it anyway. It's referring to the employees that are, the 237 staff have been vaccinated. The 110 residents have been, the 110 residents have been vaccinated. And we've been talking about this, and it's a problem with facilities. So I'm just kind of wanting your opinion, I guess. What do you do, or is there a problem with staff that aren't being vaccinated, or how do you handle that? Is there a lot of sick leave? I'm just evidently wanting an opinion, I guess. Is that fair? Do you have a
Sure.
problem with staff that aren't vaccinated, with them taking a lot of sick leave? And I know that's not a legal question. I'm just kind of looking for it to see what's going on.
Up until, well, what we're doing right now is if a person needs to quarantine or stay home, they get administrative leave. And that's been just happening as people get, get sick or they're around somebody or whatever. Now that we're vaccinated, we haven't quite figured out how to proceed because the guidance from CDC and all of that has not come out yet. So I don't have any way to tell you how that's impacted staff that didn't get vaccinated, whether they're using more sick leave or not, because it's so fresh. But I certainly will be monitoring that. I don't know if that answered your question.
Well, it's still, up in the
Hey,
air.
Crystal, this is
It'll be
Kelly.
something to watch. Thank you. Thank you, Mr. Chairman.
Very good. Committee, further questions? Okay, Brett, thank you very much for being here, and we'll move on to Mike Dixon.
Thank you, Mr. Chair. Members of the committee, can everyone hear me okay? I will follow up just a minute on the numbers that were just reported. I believe those were Parsons numbers, the 110 and 237. We received our vaccines much later than Brent did, a couple of weeks later. So we are still we just started vaccinating people, making it available 2 weeks ago. So, that 237 is well over 50% of our staff, and every day staff are still calling, wanting to get vaccinated. So we are hopeful that more and more staff will be vaccinated. With our individuals, some guardians aren't letting us vaccinate, but for the most part they are. So we are, like Brent, we're very hopeful too that we'll have high numbers 3, 4, 5 weeks from now. Parsons is a little bit different than KNI. We have a population, we serve as really the safety net for Kansas when it comes to individuals who act out in the community, are physically aggressive, self-injurious, psychotic. We currently have 151 individuals on campus. They're spread out over 10 residential units, and each unit has anywhere between 12 and 21 individuals. That's based really on the behavioral needs of the cottage. Last fiscal year, we were able to discharge 13 individuals, and we were able to bring 7 in, which is really impressive given the year that we had. Like Brent was talking about, it was a real rough year at Parsons. We were hit the end of March, the beginning of April, right when the pandemic really started going strong. We had a cottage in quarantine. We had 16 staff that tested positive, and it just wasn't staff on that cottage. It was a social worker and our infection control nurse. It really spread. Well, we were afraid it was going to spread throughout the cottages. We did contain it to one cottage, but it really was trial by fire in those early months. We were really, it was back when, even prior to the CDC mandating mask use, we were doing that. We were putting in safety measures, screening visitors, shutting down the campus to all exterior visitors, which really had a profound effect on our individuals who live here. We, at one point, early on in the pandemic, we had over 100 staff out on administrative leave due to pre-existing conditions that would make them more, that would cause them to have a more severe reaction to COVID. When that happened, that was a large portion of our direct care staff. We had to shut down all of our vocational sites. We had to move our cooking to the cafeteria, and meals had to be delivered because we didn't have the staff on the cottages to make meals. All of our professional staff were working the cottages, and everything was shut down. So our individuals who thrive getting out in the community, and which really curtails a lot of their aberrant behavior, was shut down for many, many months. They're still shut down. There's still very few things that we're doing. We're still a closed campus. I am very hopeful that here soon that will change, but as of today, that's where we're at. Looking at our individuals, their range of functioning, almost 40% are in the severe to profound range, about 35% the moderate range, and then 26% are in the mild range. Also, approximately 30% of our population is very similar to the individuals that Brent described. They have intensive specialized medical care needs. On the next slide, this is during the calendar year, going back to 2015. We do try to move people in and out. What we tell all the community agencies in Kansas, we don't have a magic wand. There's things here we can replicate in the community with staff training. So we are always working with community agencies, trying to build community capacity, because we do work with a really, really tough group of individuals. There's lots of challenging behaviors that they exhibit. So we are dedicated to building that capacity in the community, so community agencies can take them, and so these individuals can be successful when they move out. So we try to at least discharge as many as we're bringing in. It's been hard this year. Community agencies haven't been taking a lot of people for a long. We're still we have admissions closed off right now. Like I said, we had the one big COVID outbreak in March, but we had another pretty big surge after Thanksgiving in the beginning couple weeks of December. So we are just now really completely recovering from that. Next slide. So this, just to give you an idea of who we serve, 86% of our population are dually diagnosed, meaning that it's not just IDD, there's some psychiatric condition that goes along with it, such as it could be schizophrenia, schizoaffective disorder, a lot of conduct disorder, a lot of personality disorders, and 77% of them, if you look at SCMI criteria or look criteria to consider a serious mental health condition, that's 77%. On the next slide, this is really looking at physical aggression, PD, and CIV. This is just our population. 86% of our population are aggressive, 72% destroy property, and 68 engage in some type of self-injury. We, as you can imagine, based on the behaviors that I've talked about, supervision is a huge area that we look at here. 92% of our individuals here are on some level of increased supervision. That may be just that they have to be in staff's line of sight, or they can be in their bedrooms alone, but staff have to check out on them every 15 minutes. But that also could be that they have to be within arm's length of the staff at all time. So there really is quite a continuum of what increased supervision actually is. 7% or 10 of our 151 individuals currently are on one-on-one supervision. And that becomes problematic when our staffing numbers are down, because we take that staff completely out of the count. So if there's 5 staff working on the cottage and we have 1 person on that cottage one-on-one, that staff comes out of the count and they are just responsible for that 1 individual. So the other 4 staff working are then responsible for the other 11 to 20 who's on the cottage. Currently, 54 or 81 of our 151 individuals require a bedroom to themselves. They can't room with anybody else. So this is looking back to 2012, just the individuals that were admitting, how much police involvement they have prior to coming in. As you can see, this past year, it was 86%. This goes back all the way to 1979. And the reason I like to share this graph, one, it's just an awful lot of data over a really long period of time, but it shows that we're on an upward trend on our percentage of our population who receive a psychotropic med. And I truly believe that the reason behind that is just how difficult and how complex the individuals that we are getting are. One of the things that we do monitor real carefully is our med reductions with new admissions, because it is not uncommon for somebody to be admitted on 6 or 7 different psychotropic meds. That's problematic for a lot of reasons. It's dangerous for one. We immediately, almost with all new admissions, try to get as many of the psychotropic meds off as possible. And it's not a criticism of community providers. A lot of times these individuals are seeing just a family physician or a nurse practitioner, and a lot of times medications layered in and their behaviors are so aberrant and so extreme, they don't take off a psychotropic med, they add another one. And over time, you really don't know what you have. We also spend an awful lot of time. It's not uncommon for somebody to be admitted here and their diagnosis is not accurate. You know, they may be on 6 different psychotropic meds. A lot of them could be to treat mania or hallucinations, but their only diagnosis is, let's say, ADHD or intermittent or conduct disorder. Once we can figure out what the diagnosis is, then we can medicate it. And at the same time, of course, we're looking at all those behavioral principles. You know, are they attention seeking? Are they task avoidant? Is it a combination of the two? Is there medical issues with the individual? We've admitted people that are just extremely self-injurious, and we'll get them to a dentist and they'll have really bad cavities or a really bad tooth infection. And once we fix that tooth, a lot of their self-injury goes away, if not all of it. So we really look at the person as a whole, and also trying to decide what that individual wants in life. Next slide. So in 2020, it's been a rough year. You know, we have only been able to reduce or eliminate 57% of psychotropic meds that they were admitted on. That's still a pretty good number. But in 2019, even before, it's one of our lowest numbers. And the reason for that is, everyone's been locked down. There just hasn't been a whole lot of activity going on. Next slide. In addition to the behavioral programs that we provide, we do have a program for people who have committed sexual offenses. We are one of the only places in Kansas that treat those individuals. This is separate from LSH. These are people who have not been through the civil commitment process. They have offended in the past and they need certain behavior management techniques so they don't offend again in the future, but it is a different population. We still have our outreach services, our assistive technology department. And then, as I said, we have the transition house here for individuals coming out of Larned and going through reintegration. We are affiliated with KU. We have the KU CDD on campus, and they provide respite services. They have a payee program, which is extremely beneficial to our community. Their coordinated resource support services, their Kansas Equipment Exchange, their telecommunications program. Our outreach really took a hit this year too. We had to shut it down for quite a while when the pandemic was really at its worst. We have started looking at different areas in the state where the positivity rate is lower and providing services again. We're doing also as much as we can via televideo. There is a plan in place to get that up and going even more in the coming months, especially as people get their vaccinations. I had mentioned when I first started that our vocational department was shut down for several months back in April, May, June. But we're starting to, they are back open again, and we're starting to get people out and about. The one thing that we're not doing previous to COVID, all the vocational sites were mingling of individuals across campus. We're not doing that any longer. If we have a voc site open, only individuals from one cottage can go to it. Listed on the next on this slide is just some of our, and the next slide is just some of our different vocational sites. We still have our self-advocacy group, which is historically has been very active. Everything they're doing now is by phone. Unfortunately, they have not met because they're spread out through all of our cottages on campus. So they are still doing their newsletters and advocating just from a distance. They are no longer having their meetings. This gets a little into some of our staffing difficulties that we're having. This is looking back over the last 11 years, going back to 2010. We have a 12 credit hour curriculum through LCC, Lebec Community College, that our staff take. They take these classes over the course of a year. You can look back and see just over the year how many people have completed that program. In 2020, it was 25, which is a respectable number. But unfortunately, this goes back 11 years also. In the last 11 years, 294 people have completed that training. However, 126 of them are no longer employed. That's a 43% loss of newer staff over the past 11 years. And that's not including all the staff who didn't complete the classes, people who worked here 6, 7, 8 months and then quit. We, as Brent said, we do have a hard time keeping our staff long term. Our overtime and workman's compensation costs We're on an upward trend for both of them. Next slide. Number of work compensation claims involving aggressive behaviors or adverse behaviors from our individuals. It's on an upward trend also. Looking at just fiscal year 2021, if it continues the way it is, will be this past fiscal year will be 312, which is the highest that we've had. And I do think, I think this increase in claims is it's not just COVID, and it's a combination of them being not going and doing all the things they love to do, but it's also a reflection of the difficult individuals that we're admitting currently. There is a difference over the last few years on the acuity of the individuals that are coming in. Incidents requiring safety and security involvement, going back to 2011, you know, we're looking at, we're on an upward trend again. Looking at this fiscal year, we could be at an all-time high. And I think this slide has been covered also. So I will stand for questions. Oh, I'm sorry. There's more. This is our COVID numbers. We've tested 1,907 staff. We've had 122 people since it started test positive. We did have one staff who passed away, and we've had 118 recover. I currently have 3 staff out that we're not considering recovered. They all have some pretty serious complications due to COVID, and I don't expect them back soon. So they are still off, and we're not considering them recovered. With our individuals here on campus, we've tested 1,046. 66 of them had tested positive. We did have one individual die, and then we've had 65 recover. So currently, we do not have any individuals who live here who have tested positive, who are currently positive. We have so far, you know, vaccinated 237 staff, 110 residents. As I do think that number is going to continue to increase. I invited the KDHE team out to look at our infection control practices and then make recommendations based on what they saw. That was extremely useful. And I back in March, we implemented the screening of employees and residents, mandated facial coverings, social distancing, hand hygiene, increased disinfecting, and we also have mechanisms in place, systems in place, so we can go out and make sure that staff are washing their hands and wearing masks and social distancing. As you can imagine, it's very difficult to do that with our individuals who live here, but we've been successful. You know, we have a lot of our individuals will wear a mask whenever they're moving around up front with the staff. This past year has been really hard on our parents and guardians too. You know, we did shut down visitation back in March. We did open it up again for a month or two over the summer. We've shut it back down again. Currently, we're not allowing visitors at the moment. We have invested in a lot of technology. We do lots of Skype calls with parents and guardians. And I will say, they have been very patient and understanding, and you know, they're scared too. So and now I'll stand for questions.
Many questions. Well, I imagine they're both on there. Let's do Parsons first. Committee, questions about Parsons? Representative Concanon.
Thank you, Mr. Chairman. I just wanted to say thank you for sharing the information on the psychotropic drugs. I know that there is a positive use for those, but, you know, Kansas has, in the last few years, ranked poorly in the overuse of psychotropic drugs, and I think it says a lot for your employees, your staff, that you are able to reduce those, the number of those prescriptions. So I don't really have a question. I just want to tell you thank you.
Mr. Chair, this is Representative Susan.
Okay. Go ahead, Susan.
Thank you, Mr. Chair. I concur with Representative Concan, and I want to, again, thank you for really focusing on the psychotropic medication, the use, and I know people come in with so many medications, and a lot of them have been used as like chemical restraints. And I just commend on your efforts of being able to try to take some folks off of some of those medications. And of course, if they absolutely need them, that's great. But I really commend your efforts on being able to do that. Thank you.
Very good. I just have a question for both of you. I see that your budget will be, Parsons, your budget will be decreased by 1.2 million and KNI 900,000. So are you going to be able to take care of folks at the same level that you do now with those budget cuts?
I'm not quite sure how to answer that. We will take care of them regardless of the budget cuts.
Yeah, I think I was kind of pausing too, because I think the same answer. We will make it work. We'll do what we have to do. It's always difficult. And with some of the stuff that I had expressed, trying to be as creative as I can with what I got. That's what we'll continue to try to do.
And Mr. Chairman, it's Scott Brunner with KDADS. Just to pass along, we were asked in the budget process by the Division of Budget and the Governor's Office to submit reduced resource packages, and we spent a good deal of time thinking about what to offer up that would have as little impact as possible, and describe what the impact was, and we did that in the budget, and the Governor's Office decided to take those two reduced resource items. The good part of what we were able to do with Parsons and KNI was that additional federal Medicaid funds that are available that offsets the amount for general funds. So in total spending, and Matt explained this well, total spending doesn't change, but the general fund portion does drop by more than $1 million at each campus in 2022. So that, again, that we budget at what we need to operate at the normal level. That reduced resource item, we're fortunate that the federal funds are there to cover it for that year, but that's not where we want to stay long-term or past 2022.
Good, thank you. Committee, further questions? Representative Ballard has a question.
Thank you, Mr. Chairman. So we can make maybe an assumption that the CARES funding helped in some ways, did it not?
Yes. Yes. I mean, that helped with our merit pay and getting our PP and everything. So yes.
Yeah, it was very helpful.
Okay, so let me have a question about K&I. This is just because I've been there so many times and I think you do such a fabulous job. Even though you had to eliminate things, I just want to check. Did you have to eliminate your business, like your balloons, your plants, or your shops, the things that I know that your consumers really enjoyed?
Yes, we had to stand down from that through the pandemic, but they're not going away. As a matter of fact, we used, the staff that worked in those locations went out and worked in the home to support the people, but they also spent some time trying to figure out how we could do it bigger and better when we come back. So they're not going away.
Well, that's one of the things that I found just absolutely fascinating. Number one, how dedicated they were, how good they were at it. And then you also had the dental service. Now,
Yes.
you've had, so is that going to be eliminated, or you just put that on hold?
No, no, we continue to provide dental services to the people living here, but we had to restrict what we could do with the community. But we are going to be rolling that back out too with our outreach. We are not going to stop doing that either. That's really important. We got a lot of people in the community that want those services that had delay for the last year. So we're going to be very busy.
I think that's why we've spent so much time, I think, on KNI and just, I think I don't know about everyone else knows how much I really think KNI has done a remarkable job with this population, because for so many, this has been their home all their lives. And for their families, they've had that comfort knowing that you're going to provide good services. And I cannot tell you how much I have worried over COVID, how it would really affect that because of how they live. But I think whenever I think of it as those individual rooms and how they have decorated them and how they have made them personally their own and everything, it's just remarkable. I don't know what other states do, but I know we do a remarkable job in that area. So thank you for just letting me know it's not going away. And I know it's something that the public values, but it also provides unique opportunities for your residents. So thank you so much.
You bet. Thank you.
Very good. Committee, further questions? Okay, with that, we have one person. Joan, I'm so sorry we've taken so long, but we appreciate you being here. Joan is a huge advocate of KNI. That doesn't even start to describe your advocacy. So anyway, thank you for being here.
See if I can get this going here. Thank you, Chairman Carpenter and members of the committee. Thank you for your endurance today. I will not talk too long. I'll be as brief as probably 10 minutes. So my name is Joan Kelly, and on behalf of our most fragile, who are unable to protect or care for themselves, this is why I'm here today. Our 30-year-old grandson is extremely strong, hyperactive, and functions cognitively at the infant toddler level. He's been well cared for at KNI for over 12 years. He was raised in the community by us. We accessed community services and spent thousands upon thousands of dollars trying to make the community system work. Individuals like him with profound autism routinely, as has been mentioned, severe and very problematic, unpredictable behaviors that cannot be managed in community settings well in general. The experts who specialize in working with these individuals recognize that they require 24/7 care and experienced caregivers, professionals, and well-structured programs, which these gentlemen just so eloquently described. They must be surrounded by well-paid staff, well-paid aides, as has already been said. Their health and happiness and safety depend on it. Time will not permit me to share today the mounting number of community atrocities happening across our nation, but I think that we can all agree that retrofitted emergency hospital rooms and jails are a costly and inappropriate substitute for intermediate care facilities. We're keenly aware of improper settings increasingly being used across our nation, particularly when facilities like KNI are downsized and closed. We continue to hear verbiage of a system that needs rebalancing and less reliance on centralized care, when in fact, only a very small percentage of the DD population still live in facilities like KNI and Parsons and similar facilities across the nation. Having witnessed firsthand the superior care that our loved one has received for over 12 years, I can assure you that any narrative you might hear that we are throwing our loved ones away into an isolated congregate warehouse is simply not true. I will speak briefly on COVID. It's been covered well by these the men who take care of our children in the superintendent position. But I just want to remind everyone here that there has not been one death at KNI since the outset of this pandemic nearly a year ago. I think that's pretty telling. The Center for Medicare and Medicaid requires states to offer a choice of settings for their clients. And according to that regulatory agency, which oversees KDADS, individuals must waive their right to the ICF option when they request services. However, in practice, KDADS hinders families in crisis from accessing this Medicaid-endorsed option. They forbid families to access the ICF choice unless families first exhaust all community options. And we actually incurred that when it was still SRS. So these arcane gatekeeping policies have been in existence for quite a while. Requiring families to jump through hurdles when they're already in crisis and coldly implement the gatekeeping structure which continues at KDADS is alarming to me. There was an opportunity to provide public comment to KDADS regarding those policies, and as an expert of 28 years raising my profoundly difficult grandson, every single comment that I made was ignored by KDADS. I have also attached today, for your convenience, supporting documentation from another parent who has experienced and will confirm what I just described to you regarding the indirect but hostile addressing of families in crisis. I think we realize that it's really not possible to staff, have to have appropriate levels of nursing and other supports in small community scattered settings. This as could be accomplished when we serve a greater number of individuals in a larger facility. If the CMS regulations were simply followed as they were simply written, if KDADS would actually follow those as they were simply written, instead of adding on layers of requirements to dedicated families in crisis like ours and many others, we could actually be enjoying first of all, a relief from crisis events from dedicated families, but also we could be enjoying the benefit of an economies of scale in KNI and Parsons if money were allocated properly to allow the DD system to balance itself out naturally and accommodate families who actually need this level of care instead of fighting, keeping them from accessing the care their loved ones require. It would ease the taxpayer cost per person burden, which I'm sure you're all very much aware of. In accordance with the Supreme Court Olmstead decision, institutional care is not only needed, but it must remain available. The court's holding emphasized choice, not forced integration. It recognized that people were should neither be required to live in an institution or forcefully evicted, which quite frankly, ladies and gentlemen, is happening across our country, and untold tragedies are happening to families due to a pendulum swing which does not recognize the true cost, which is the lives of their children. Sorry to have to say that, but it's true. Right now in Kansas, there is a push for a, quote, an Olmstead plan. And a number of you probably are on different committees that may hear about this. I will tell you that I work with national organizations and parents all over the nation, and every state that has tried to implement an Olmstead plan, number one, has not consulted our families who have firsthand experience dealing with the most profoundly disabled individuals. But their unspoken goal, just put this in your back pocket, their unspoken goal is to downsize and close KNI and Parsons eventually. So that's just a warning, a respectfully given warning. I'll wind up here and just say that I think everybody knows here that the IDD population is very diverse and complex. There's a staggering explosion of individuals with autism, and the landscape now, as has mentioned, has shifted dramatically towards this behaviorally challenging population. Jails and locked ER rooms in hospitals have become the de facto solution in many cities due to the lack of viable alternatives for these highest risk individuals. My husband and I are forever grateful for the continuum of compassionate quality care that K&I has provided. ICFs are desperately needed for the safety, as a safety net for our most vulnerable and fragile citizens. They require what is equivalent to an ICU level of care in our medical hospitals. That's the level of care that many of them require, since their conditions are extreme and they're lifelong. And in closing, I just want to strongly and respectfully encourage this committee to fully fund, asking for incremental wage increases and salaries for all the dedicated staff at K&I, and I'll include Parsons, even though my grandson's at K&I, who compassionately serve our highest risk, most medically complex, and behavioral challenging individuals. Thank you for the opportunity, and I stand for questions.
Any questions? Representative Ruiz?
Sorry, Representative, Mr. Chair, I did not take my hand off. So I don't have a question.
All right. Representative Ballard.
I don't have a question, but your testimony was very eloquent. And I think of how long you waited to make these comments. But, you know, that was one of the things I think when we decided years ago to still keep it open, because you know what the fight was for so long, not to have it stay open. I think many of us on these different committees, I mean, even though it was this one, different people have been on it, saw the value in the services, the value in the quality and the treatment, and the value of that human aspect. And I think that's why we still have it today, because people like you have spent so much of your life taking care of it on your own before you had that opportunity to move it on. And I think it's that peace of mind knowing that whether you're here or not here, that those services will remain.
I pray they do.
I thank you for taking the time to come today to just let us know you're just one of many families that value this service from the state of Kansas. So thank you very much.
Very good. Thank you, Joan. Thank you for being here.
Thanks again for listening.
Committee, further questions?
The only comment may I just make about Parsons talked about having difficulty hiring nurses and what they came up with in order to make it part-time to solve that problem. And part of that is solutions to a problem. You know, when over a year you can't find a nurse that really would do this, and they came up with a solution to maybe meet the needs of that nurse in the 2 days versus 5 or whatever they wanted. And I think they should be commended for trying that, because they found a population that was willing to work that way to make things work for in their lives and their families. But they solved the problem that they desperately needed. And just want to say thank you to them for doing a really fine job to find a solution.
Very good. Thank you, Representative Ballard. Committee, further questions? With that, that concludes our budget hearings on Parsons and K&I. We are adjourned.